Well, the ongoing strike has hit hospitals hard, leaving staff exhausted. There are reports of non-striking health workers staying at their posts for extraordinarily long hours and, disturbingly, patients being found dead in their beds, although it remains to be shown, as you heard in the earlier interview, if there is a direct connection between the strike action and their passing. The Northwest Hospital Tshepong reports bearing the brunt of the action, with protesters actively blocking entrances there and elsewhere. One protester was photographed inside a hospital carrying a sjambok. And some of these reports are according to the Daily Maverick citizen journalism unit led by Mark Heywood, who joins us now. Mark, good evening to you and welcome. The piece you compiled is chilling. Reportedly, in one facility, there aren't even any pediatric nurses. And in Umtata in the Eastern Cape, protesters shut down the emergency services centre, saying no patients would be allowed to be transported. Tell us a little bit more about some of the impact of the strike reports that you're getting.
Good evening. Yes, the reports are chilling and it's a tragedy. And I have to say that it is doing enormous damage to patients, harming patients. I believe that it is costing lives. As you mentioned, there's one hospital that reports that in the morning they found 4 patients dead in their beds. As has been said, you can't prove the causality, but patients are not getting drips replaced, are not getting rehydrated because there are no nurses. Some patients are not being fed. Some patients who need assistance in order to eat, stroke patients, are not getting that type of assistance. You know, and there's a terrible fear in many of the hospitals, nurses and doctors who are working to try to keep patients alive and comfortable and fed and healthy are being threatened. They're very scared. Some of them are being locked into the hospitals. And, you know, several doctors have said to me, well, this bodes very badly for the future of the health profession, because many doctors are saying, particularly young doctors are saying, well, is this really the job that I signed up for? You know, is this what I want to continue doing? So I think it's hard to quantify the damage that is being done at the moment. And I think what's most tragic is that some of the people who are involved in this are people who have gone to the greatest lengths to protect and save lives during the COVID crisis, after the COVID crisis. So it really is very challenging to understand what has driven people to this type of behavior.
It's come to the point where you've heard calls for the army to be deployed. Tell us about that.
Well, doctors are asking for the army to be deployed, particularly the medical services of the army, the South African medical services, because they're not able to cope. So they've asked for assistance. And yeah, I mean, people are saying, how many hours can we stay up for? How long can we sustain providing this care for? Some people are worrying about how many days until the food runs out. You know, some people are having to take money out of their own pockets to provide care. So even the limited care that is there at the moment is in danger of snapping the longer this continues.
Yeah, I want to really focus, Mark, on the responsibility that both government and the Treasury, well, the Health Department and Treasury share in this. There is a minimum service level agreement. It's stuck somewhere in the pipeline. What is it meant to ensure, and where is it now?
Well, you know, as you know, I've been involved as a health activist for several decades now. And I remember the 2010 public sector strike. And one of the issues in the 2010 public sector strike was precisely access to healthcare services, the danger to patients. And at that time, we raised this question of the need for what's called a minimum service level agreement, so that when workers, essential workers like doctors and nurses, exercise their right to protest and their right to strike, that there is an agreement in place that you maintain a minimum level needed to ensure that people don't die, that people don't suffer. And back in 2010, everybody was saying, yes, this is urgent, we must negotiate it. Well, here we are in 2023. There's still no minimum service level agreement. And what this reflects on, I believe, is just a neglect of the healthcare system and of healthcare workers and of healthcare infrastructure that we have to put at the door of the national and provincial departments of health. The reason our health system is imploding is because the budgets have been cut year after year, including again this year, because posts are not being filled, so fewer numbers of healthcare workers are caring for larger numbers of patients and are not having their own health needs, their own mental health care needs attended to. So there was a certain inevitability that this was going to happen at some stage, but it doesn't lessen the tragedy or lessen the anger that many of us feel that healthcare workers could put their patients in such danger. I'm very sad because I have a great deal of sympathy with the nurses, with the clerics, with the admin, with the security people, with the doctors. I don't think that we care for our public healthcare service properly. But I'm challenged by the fact that these people who are being maltreated are the poorest of the poor. They're the most vulnerable. They're not people who can even get out of bed and go home because they're sick.
Mark, thank you very much for talking to us and for sharing just this topographical picture of how the strike impact is playing out across the nation. That was Daily Maverick Citizen Journalism Unit Editor Mark Heywood.